When we look into your eyes, we want to give you the whole world. But that's not a viable business model. So instead, we're offering you complete glasses from only $69. At Specsavers, we believe quality eyewear and eye care should be affordable to all, which is a little thing we call Specsavers Love. Find out more at specsavers.ca. Conditions apply. Select pairs only.
This is a CBC podcast.
Hi, everyone. I'm David Common, and this is the Power and Politics podcast for Friday, October 15th. On the pod today, get vaccinated or lose your pay. It's a strict mandate that only a couple of provinces plan to impose on their healthcare workers, but now Ontario is considering it. The Premier, Doug Ford, though, says he needs help deciding. Ford is asking hospital CEOs for their input, worried they can't afford to lose their unvaccinated workers. MPPs are here with their own input just ahead. Plus, British Conservative MP Sir David Amess has died after being stabbed while meeting with constituents. We will speak to a colleague about the parliamentarian, and as that incident is declared a terrorist incident, the growing risk that many parliamentarians face. First, the CBC's Megan Fitzpatrick is here with more on Ford's remarks. All right, Megan, walk us through what the Premier is thinking here.
Yeah, well, he's saying that, some hospitals in Ontario have gone ahead and implemented their own vaccine policies, but he says some have been advocating for a province-wide one to mandate that workers in hospitals get vaccinated. And he's weighing the risks of that policy decision, he says. He also says he's been watching what's been happening in other provinces that have gone ahead with these policies, like Quebec and BC, noting that Quebec actually just delayed its mandatory vaccine policy. Healthcare workers there were supposed to be vaccinated by today. They've pushed that back a month. And so Ford says he's keeping an eye on that, David. He's clearly very concerned about what impact this policy might have on staff levels at hospitals. He says right now the latest estimate is about 15% of the healthcare workforce in hospitals is unvaccinated. And he says hospitals are already facing staffing shortages and their existing staff are stretched really thin. And so he's concerned that if workers are forced to be vaccinated and they are suspended perhaps or choose to quit, what that would mean for the healthcare system. So he sent out a letter to hospital CEOs today, as well as other health experts, asking them to weigh in. He listed a series of questions for them to answer, including how would this kind of policy benefit their hospital? What would the negative impacts potentially be on recruiting and retaining staff? He wants to know from them, should the government mandate it or continue to leave it up to individual hospitals? He wants to know if there's parts of their hospital systems where unvaccinated workers could potentially be reassigned to other roles where they're not interacting with patients. So these are the questions he's asked. He wants the feedback. And he wants it by Tuesday, so those experts, David, they have some homework to do over the weekend.
Yeah, absolutely. Okay, speaking of which, I want to talk to you about Ontario's top doctor, also at the news conference with the Premier today. What's his position on all of this?
Yeah, he seemed pretty clear how he felt about this. He said he thinks it's a duty for healthcare workers to be vaccinated. He also called it a personal obligation for healthcare workers interacting with patients to be vaccinated. He also told us that there are consultations ongoing with other healthcare workers, like family physicians, for example, and potentially implementing vaccine policies for them. He says the government's talking to the College of Family Physicians and the Ontario Medical Association. He hinted some news on this front could be coming next week, David. He said, within healthcare settings, infection prevention and control measures can work well, but there can still be some gaps. And that means there are still risks of COVID spreading within these settings and putting patients at risk. So he was pretty clear. He's in favor of mandating vaccines for healthcare workers. We'll see what the government decides. The government has already gone ahead and mandated vaccines for long-term care home workers. So this could be the next step, but we'll see what Ford decides and what he has to say about it next week.
All right. Megan Fitzpatrick, thanks very much.
You're welcome.
Let's go now to the political reaction to Ford's request for input on vaccine mandates for healthcare workers. We're going to go to David Smith, the Progressive Conservative MPP for Peterborough-Kawartha. He is in Peterborough, Ontario. Merritt Stiles is the Ontario NDP MPP for Davenport. She is in Toronto. And John Fraser, the Ontario Liberal MPP for Ottawa South, and he is in Ottawa. Okay, let's go to these questions, and I will start, David Smith, with you. Why now, after you see the Windsor Hospital having already not only put in a mandate, but actually started firing the unvaccinated? You have UHN, the largest health network in the entire province, the entire country, in fact, that's put in a vaccine mandate. Why are you dealing with this now as opposed to months ago?
As we were looking at this, we were seeing the vaccination rates increase significantly with people, and we've come to a point where it's started to plateau. We know that the way out of this pandemic is through vaccination. So we needed to see what was going to happen at the hospitals. And now Premier Ford has reached out to all of those hospital CEOs to see what the situation is at that hospital. I've said before, and I'll continue to say it, you can't make an informed decision if you don't have all the information. Now, Premier Ford is reaching out to get that information to make sure that we get it right. We can't be in a position where we're canceling surgeries, where we are not able to provide services for a patient when they come in because we don't have enough staff. So we need to see what those ramifications are.
Okay, but
let's face facts.
David Smith, the question is why now? Like, why wasn't this thought of months ago when we knew this was coming down the pipe? Why wait for hospitals themselves to put in a vaccine mandate, to start firing people, to start threatening to fire people, the largest hospitals in the entire province, before you start asking them what you should do?
We needed to have time to send the vaccinations out to people, to actually get the shots in people's arms. And that is what we have been doing. Now we're at a point where it has started to plateau. So we need to see what the effects are at those hospitals. It's the prudent approach to take.
Okay, Merritt Stiles, I want to go to you. When you look next door in Quebec, they put in a vaccine mandate provincially and said, we're not going to budge on the date, we're not going to budge. And then they didn't see the vaccine rate come up. They worried about the very thing that the Ontario Premier is worrying about, losing enough staff to create something of a critical mess. Is it not then prudent what Premier Ford is doing, taking a cautious approach?
Well, I mean, you could call it cautious, I suppose, or you could say, like most Ontarians were today, what took you so long? Where was the Premier? I mean, I think Ontarians have shown that they're willing to take responsibility overwhelmingly, and they've been doing the work to keep their communities safe. The fact that the government today and the Premier came out with all these whataboutisms, basically saying, I have so many questions. We are in the fourth wave. It's mid-October. Where was the Premier all this time, and why was he waiting so long? And I think for a lot of us in here in Ontario, we look at what other provinces are doing, but we look to what our own leaders are doing. And what we heard today was a government that doesn't seem to have any solutions in a crisis still to this day. It's really, I think, unnerving because, in the pandemic, certainly one thing we've learned is that people want strong leadership. They've put the time in, they put the effort in. They want somebody who's going to have solutions. I mean, if the government is so worried about a crisis among healthcare workers, they could actually revoke Bill 124, which prevents healthcare workers from negotiating better pay or working conditions. There's a lot more they could be doing. And I think, again, what we heard today was the government just pushing this off to healthcare administrators at a time when Ontarians are demanding that our government actually step up to the plate. Okay,
John Fraser, let me go to you. The Liberal proposal is that you should have a mandate, but not for all healthcare workers, for frontline healthcare workers. Wouldn't having all staff face a mandate make hospitals safer?
I think that you have to make everyone who's on the front line, and includes people who are working with people on the front line. So, it's mostly people who are working remotely that would be not captured by, I have a private member's bill that we're going to be debating next Wednesday. Here's a really interesting thing. The Premier wrote a letter asking for what the hospitals asked him for last June. Hospitals just told him at the beginning of October, we want the same policy across the board in healthcare that you just did in long-term care. And now he's asking them what they want. So we put forward the bill because it's reasonable for families to expect that the person who's caring for a loved one in hospital or in home care or any other healthcare setting, that person's been vaccinated, or their teacher or their childcare worker working with their unvaccinated child that that person has been vaccinated. That's a perfectly reasonable expectation of families. And the Premier's delaying and dithering when, 4 to 5 families, they want this. And he's really essentially saying, like, well, I don't think that's a reasonable expectation, so I'm not going to help you with that. It's really hard to understand why the government has taken so long that Ontario's, so long to do something that Ontario's doctors, Ontario's nurses, and Ontario's hospitals have been asking him to do for months.
Okay, well, I want to talk to you also about something that's being done by the several hospitals under the UHN, the University Health Network umbrella in Toronto. And they have said not just that they're going to have a vaccine mandate for their employees, but also one for visitors too. There are some exemptions like labor and delivery. David Smith, do you think that is something that should be applied province-wide?
I think that what we need to be doing is everything possible to make sure that we are reducing the opportunity for spread of this disease. And when a hospital is coming out with any kind of a policy like this, let's keep in mind that they are the experts in infectious diseases, in preventative measures. So if they're coming forward and saying this is what we should be doing right now, this is what they need to do in their hospital, then we should be respecting that. And we shouldn't be second guessing it and trying to override what a medical expert or what medical experts are actually saying.
Okay, there is one major, the largest hospital network, the one that by its own description has the sickest people in the province inside, that has made that a vaccination mandate policy for visitors with some exceptions. Do you think that should be applied more widely and not just in those several hospitals?
I think that what we have is a number of different situations across all of Ontario, and we do have 140 hospital systems in Ontario. The situation in Ottawa could be very different than the situation in Timmins. It could be very different than the situation in Toronto, where UHN is. Mm-hmm. Here in Peterborough Regional Hospital or Peterborough Regional Health Centre has followed almost lockstep with what UHN has done. So I think that it's incumbent upon us to take a look at what those hospital executives are saying, because they understand the situation, the reality in their community better than we do across the entire province. And let's get those experts to give us the advice on what we should be doing.
Merritt Stiles, vaccination mandate for hospital visitors?
Look, today when the Premier was asked some of these questions, he gave this catalog of different reasons why he couldn't make decisions on a bunch of things. And I think at the end of the day, one thing we can all agree on is that our priority when it comes to our hospitals has to be prioritizing the most vulnerable patients. And so I think when leaders like University Health Network take a position like this, yes, the government should listen. And, MPP Smith there is saying, yes, you should listen to the experts and you should listen to each hospital. And oh, by the way, listen to other people. Look, this government has over and over again been told what needs to happen and have chosen to download decisions. They do not want to make a decision. They do not want to be held responsible for anything. And in this moment, it's so important that government is stepping up. And so, I think that while I totally agree that every hospital is going to have a say on this, as I know John pointed out, look, hospitals have been saying a lot of these things. They've been coming forward with plans and requests to the government, asking the government to step up and back them up, just like small businesses has been asking and school boards. And the government continues to download all of those decisions to the very, very localist level and not funding as well, I will say, adequately the actions that are required to keep everybody safe. So once again, the priority needs to be keeping those vulnerable patients safe. And I think hospitals are actually have written to the government quite clearly what their expectations are, and the government needs to show some leadership.
Okay, John Fraser, I go back to that original question with you and the idea of a vaccination mandate for hospital visitors.
Yes, I think it's a reasonable, very thoughtful thing to do. They've done it here in Ottawa. I think it should be a province-wide policy. These policies are not forever. This is to manage the pandemic that we're in right now. Now, the interesting thing about vaccine mandates, the Premier threw out a number of 15% of healthcare workers aren't vaccinated. But and I know this happens in other hospitals, but the hospitals in Ottawa, CHEO, their vaccination rate is 99.3% for full-time staff, almost 98% for part-time. The Queensway Carleton Hospital, 98%. So, the evidence just doesn't bear out what the Premier's saying. Making sure that people are vaccinated going into any healthcare setting is important, not only protect the vulnerable people who are there from outbreak, and illness, but also to protect them from staff having to be off work because they test positive. No one's talking about the human resource risk that unvaccinated people pose or workers pose inside an organization. If you want to talk about not having staff when you need them, if 25 people are off because there's an outbreak or they've contracted that, that's serious. So I question the Premier's reasoning and numbers in saying, we've got to delay even further than we have right now.
All right. We will leave it there. Thanks.
Can I jump in on that comment?
You got like 10 seconds. 10 seconds, yeah.
It fully reinforces exactly what the Premier was saying today. We need to know what is happening at the hospital level and how this will affect their staffing if we were to do something.
If you don't know by now,
exactly
the evidence is there, David. The evidence
is clearly there.
Okay, we're going to leave it there. Thanks very much to the three of you, and have a good weekend.
You too. Thank you.
Thanks.
As it stands, hospitals in the province are left to implement their own vaccination policy. So is that sufficient? Should Ontario implement its own broader vaccine mandate for healthcare workers? Power Panel is here to talk about that. Nigan Sinclair is a columnist for the Winnipeg Free Press, the Globe and Mail's Marika Walsh, Paul Wells with Maclean's, and the Logic's Marty Patriquin. Marika, let me start with you, because this is coming in Ontario not after most provinces have already done it, but it has come after many hospitals have already implemented a vaccine mandate for their own staff. And in fact, some hospitals, they've already hit the deadline and started to fire unvaccinated workers. What are we to make of the timing here?
It's something that certainly the MPP for the Ford government was not able to explain at the top of your show. In some ways, it seems the horse has left the barn, but we do know that some people or some organizations sort of want that cover from the government in order to implement these mandates. Certainly, they're not leaving them a lot of time to weigh in if they only have until Tuesday to do so. And so you would expect then that they're expecting to move pretty quickly on this. I found it very interesting that Kieran Moore, the medical officer of health in Ontario, and also Dr. New, the Deputy Chief Medical Officer of Health or Chief Public Health Officer in Canada, both sort of invoked the rights or the duties of medical professionals to do no harm and therefore to get vaccinated. I found that link very interesting, and clearly we know, I guess, where they stand on the matter. It's just what the Ford government will choose.
Yeah, and they've given a deadline of Tuesday to get advice from these hospital CEOs. But, Marty, I want to go to you because Quebec, of course, is one of the very few provinces, just a couple of provinces that actually have gone to a vaccine mandate. And as we all now know, the deadline was supposed to be today, been pushed back a month because of how many unvaccinated workers there are and the worries about that essentially hospitals would be left in the lurch suddenly by having to get rid of some workers. So is there some prudence on the part of Ontario Premier Doug Ford here?
I would like to think so. Doug Ford doesn't like vaccine mandates. He doesn't like vaccine passports. He doesn't really like mask mandates. He's proven that over and over again. So I can't help but see this through the lens of just that, of a man kicking the can down the road and basically trying to put the political onus on the hospitals and the hospital CEOs instead of having himself come out and say it. I think he wants some backup, which is fine. That's a political move, which he can do. The unfortunate part about it, though, is that it just delays. That's not exactly what we need right now. As far as Quebec is concerned, yes, they put it off by a month, but Quebec is, and I suppose Ontario too. They're foisted by their own petard a little bit. The staffing shortages within Quebec hospitals were a near chronic issue well before COVID, and we're sort of basically following from the hangover of that.
Yeah, although that might be right across the country.
For sure, I think. But again, it probably the extent to which I think it probably depends on the province. It's really, really bad in Quebec. It's not quite as bad, I don't think, in Ontario. But suffice to say that them backing off this and saying this just basically proves that they have absolutely no leverage whatsoever when it comes to additional staffing, and that is on them, and that is a problem that predates the pandemic.
Nigan, let me go to you and then to Paul. Is having a potential labor shortage a fair argument for not implementing a vaccine mandate for healthcare workers?
Well, absolutely. I think in certain contexts and The fact is that there are a sort of a bare minimum. People in areas of the country are being asked to come out of retirement to support even vaccine rollouts and so on that are going on within hospitals and other healthcare facilities. But if we look at Windsor, one of the big sort of moments was a few weeks ago when the Windsor Hospital put 172 people on suspension without pay for not getting COVID-19 vaccination. Of that number, there was only a handful or so, or 9 or so, professional staff, and much more of those were people who were positions. Mm-hmm. And so the fact is that many of the professional staff are getting vaccinated. And it's not to say that, of course, health assistants and those who work in a hospital but aren't perhaps dealing directly with patients on a day-to-day basis aren't important. Of course they are. But it's also to say that the issue may be with some of those support staff that may be in a position in which they may be easier to replace, or they may be in a position in which they will then turn around and realize how important their jobs are, how valued their jobs are. And they, in the Windsor case, we've seen about over 24 people get the vaccine shot from that 170 or that 160 or so of the non-professional staff. So, I mean, we've got some real challenges facing us in terms of healthcare. And Doug Ford's right, I guess, to walk carefully. But I completely agree that this is a political move. This is a move to push the attention off himself, that he's not seen as directing hospitals to lay off workers in the middle of a pandemic. Yeah. But he wants to share that blame with others. And he particularly doesn't want to face the wrath of any legal challenges that will come out of this for, as we've mentioned several times, and I keep mentioning countlessly, that there's a constitutional challenge that's just sort of waiting to happen in terms of even mandating vaccines for travel. Because as we'll see with MPs coming back, we've got some issues with MPs not getting the vaccine either. And I think that's where the constitutional challenge will likely come from.
Yeah, particularly when you're talking about MPs who wouldn't necessarily be able to get on an airplane to come to Ottawa if they are in another province. That makes it much more complicated. Paul, I'll get you to sort of pick up on this broader healthcare vaccine mandate. But I also would just throw to you the idea of what can you do as either carrot or stick for those healthcare workers who are reluctant?
It beats me. I don't think the Quebec case has gotten enough attention outside Quebec because it's the damnedest thing, and it suggests that there's no easy way to govern in this area. The Quebec government was absolutely decisive, absolutely categorical in ways that Doug Ford hasn't been. It was backed up by the professional orders, the sort of professional associations of nurses and support workers who said, if you don't get vaccinated, you're kicked out of the profession. You will no longer be essentially licensed to practice in the field where you've been practicing. And despite that, perhaps as many as 20,000 people were not going to be vaccinated by what was the original deadline. And I don't know what you do about that. Mm-hmm. I've been vaccinated twice. I got vaccinated as soon as I can. In principle, I support vaccine mandates. I understand why people think it's important. There's a lot of people who disagree with me, and it turns out they do important things in the public sector, and they're near impossible to replace in short notice. And that's a real conundrum.
Marika, sort of in our final minute here, let me come back to you and just say, is it inevitable, if this is, as some suggest, simply political cover for Premier Ford to get somebody else to tell him he's got to do it so that he can say, well, they told me to do it, does that mean that there is an inevitability here?
It certainly does seem, as Marty said, a bit of a PR exercise, and we have seen the Premier do this prior in other cases, in other sort of getting feedback, getting buy-in on things. I mean, I think the question is, yes, there might be staffing shortages that come from imposing the mandate, but if there is an outbreak at a hospital because of an unvaccinated worker, that's also a serious staffing issue and a serious healthcare issue for a hospital. Mm-hmm. So I'm not sure it's one way or the other way on this. And we know that they are a stick rather than a carrot, but they work. Vaccine mandates work. We see that in Ontario and Alberta. We see that appointments for vaccines went up after mandates were brought in. And so, again, it seems also that the biggest hospitals in Ontario already have the buy-in. They've already given the province buy-in because they already have these things.
Of course, so seemingly did vaccine lotteries and gift cards.
That's the point there.
Yeah.
Right.
That's absolutely Maria's right. If Marika's right, if you poll the people that Doug Ford is reaching out to, I am willing to bet a lot of money that they will be violently in agreement of having a vaccine mandate. It's political cover.
When we look into your eyes, we want to give you the whole world. But that's not a viable business model. So instead, we're offering you complete glasses from only $69. At Specsavers, we believe quality eyewear and eye care should be affordable to all, which is a little thing we called Specsavers Love. Find out more at specsavers.ca. Conditions apply. Select pairs only.
During his lifetime, the late John le Carré wrote numerous letters to people of note, from writers to spies, politicians, actors, and artists. The never-before-seen correspondence of le Carré, one of the greatest writers of our time, are collected together in A Private Spy. This beautiful volume is a treasure trove, revealing the late author's humor, generosity, and wit alongside the unfolding of 20th century history. A Private Spy, available now from all good bookstores.
Dr. Adam Kassem is the president of the Ontario Medical Association. He is in Toronto. Dr. Kassem, good to see you tonight. And I know that the OMA has been saying it's in favor of a vaccine mandate for healthcare workers for many months now. There is this letter on Friday from the Premier now seeking urgent input from hospital CEOs. What do you think about the timing?
Well, David, as you've mentioned, Ontario's doctors called for a mandatory vaccine policy for healthcare workers in July. We did this because we know that healthcare workers should protect themselves, their patients, and their communities. We also know, and this is very, very clear, that vaccines are the best way to control the spread of the virus, COVID-19, and remains an essential component in protecting our patients, our families, our friends. I appreciate the Premier's concerns, absolutely. And as a frontline doctor who's fully vaccinated, I know that I stand proudly shoulder to shoulder with my physician colleagues who will continue to advocate for full vaccination of those eligible. It's clear that our system, our healthcare system, has been under a great strain over the past 18 months. It continues to try and evolve at a rapid pace. We're looking forward to a recovery and a rehabilitation of our economy, our healthcare system, our society, and these are the types of things that we're focused on.
We were speaking with some panelists earlier on the show who essentially were suggesting that the Premier in Ontario is seeking cover, getting other people late in the game to say we need this, so that he can say, well, those were the people who told me I should do this. Do you think that's what's going on?
David, I can't comment on sort of that kind of that situation. What I can talk about, though, is that at least for your audience and for your viewers, 98% of doctors that we surveyed at the OMA are fully vaccinated. I'm one of those, and so is my wife, and I know most of my colleagues are fully vaccinated. That means that doctors are not only talking the talk, we're walking the walk, we're leading by example, and we're actually also turning our attention to thinking about how booster shots, for example, for some of our members, could be implemented in the same way that other jurisdictions, namely Manitoba and Quebec, have begun contemplating as well. And so we continue to urge all of those who are eligible to get the vaccine. And if you are still on the fence, if you are still having questions or concerns, I urge you to reach out to your doctor, get the best information to make the best possible decision about your healthcare and the healthcare of your loved ones.
The Windsor Hospital has a vaccine mandate. And it has now let go staff who were not fully vaccinated. And that included at least one physician. University Health Network hospitals in Toronto are facing a similar situation where there's at least, it looks like more than one physician, not a lot, who are likely to lose privileges at the hospital given their vaccine status. Does it surprise you that a physician would not be vaccinated at this point?
I think that the evidence is very clear that vaccines work, that they're safe, that they're effective, that they've helped to create capacity in our healthcare system, but ultimately protect Ontarians and frankly, Canadians writ large. I'm concerned about, obviously, the health human resource situation that's currently live on the ground. And more importantly, we understand that losing one physician is one too many. And so I think that we have had a situation of a doctor shortage for quite some time in this province and in this country, and we're seeing the impacts of that kind of shortage play out right now.
You talk about the number of healthcare professionals who are not vaccinated. The Premier putting that number at about 15% of the total healthcare workforce out there. What do you think is necessary to close that gap? And let me put it to you this way. Does there need to be a vaccine mandate? Yes, you've suggested that, and perhaps you're suggesting that for reasons of safety for patients and co-workers. But do you give people more time to try to get there?
It's still not too late to get people vaccinated, David. We're seeing Quebec, for example, extend their timelines. We know that the vaccines, for whatever reason, and for healthcare workers who are still unvaccinated, it's still not too late. We're happy to have those conversations, to advocate, to educate. And in conjunction with mandatory vaccine policies, I think this is a strategy for the future. I know that this is a concern. We have, I think, in Ontario at least, really weathered the storm of a fourth wave right now, and that's primarily due to the vaccines. We also know that people in hospital, predominantly in the ICUs who are suffering from COVID, are those who are unvaccinated. So we continue to advocate for this administration of vaccines, and we'll continue to do that.
We're talking about the in-hospital environment primarily here, but I know Ontario's Chief Medical Officer, Dr. Kieran Moore, was in discussions with your association about immunization policies for primary care physicians, so family doctors, for instance. Can you take us through those discussions?
Well, certainly we know, again, David, that we want to have all of our staff, especially in the community, have the vaccine as well. This is important for not only keeping the infrastructure of community-based healthcare open and running and making sure that we're getting through the backlog of care that has unfortunately arisen as a result of COVID-19, but mainly, for the most part, to try and encourage all of the patients that are coming through the doors of these clinics to also have the confidence that their places of getting care are also safe.
I mean, you went to medical school. You work around other doctors. Are you surprised at all that there's any physician, as highly educated as you have to be, as much of a science background as you have to have? Are you surprised that there are any physicians that are unvaccinated?
David, I'm sure that there are odds and ends here that, as you've already described, where that number seems to be relevant. But I do think that 98% of doctors, and I know that to be a fact, at least based on our data, suggests that 98% of doctors are fully vaccinated. And so we have, I think, for the most part, shown tremendous leadership. Are there outliers? Sure. But for the most part, we should be concentrating on the vast majority of physicians who go into work day in and day out to take care of the people of Ontario and Canadians.
So it's 98%. What's 2% of Ontario's doctors? How many people is that?
Well, so you're testing my math here, yeah. David. We have roughly 40,000 physicians that we serve. So somewhere on the...
So 400, 800 doctors.
Possibly. That's based on the representative sample that we've had in-house. Yeah.
Let's hope my math is right. Someone will correct me if I'm wrong. Dr. Adam Kassem, thank you very much for your time this evening.
My pleasure.
British police say counter-terrorism officers are leading the investigation into the murder of a member of Parliament. Sir David Amos was stabbed to death today at a church near London.
We made it clear at the time of the incident that we did not believe there was any immediate further threat to anyone else in the area. It will be for investigators to determine whether or not this is a terrorist incident. But as always, they will keep an open mind.
We can now say that the 69-year-old Amos was attacked and killed during a meeting with constituents, and it is a meeting that the Met Police now say has been declared a terrorist incident. A 25-year-old man was arrested at the scene, and a knife has been recovered. Police gave no immediate details on the motive for the killing of the long-serving MP. Prime Minister Boris Johnson said he and his cabinet were deeply shocked and heart-stricken by the murder. Just before it was declared a terrorist incident, we spoke with Andrew Percy, a Conservative MP in the UK, who was in London. This is an awful day to be speaking to you, Mr. Percy, but thank you certainly for your time. Sir David.
Actually, I mean, it's just...
Yeah, no, go ahead.
No, I said, yeah, I mean, it's absolutely terrible what's happened today, but, happy to join you because obviously we don't want these events happening again.
You had known Sir David Amos since you were first elected in 2010. I mean, what can you tell us about him?
Well, he'd been there a number of years. I think he first was elected in '83, but he was one of those members who was so welcoming and friendly of new members, such as back in 2010. He was, as everybody who's come, I mean, when anything tragic happens, people always say very nice things. But in this case about Sir David, they were genuinely deserved as well. He was, always had a level of cheerfulness that, many in politics struggle to maintain. And for a new member coming in back in 2010, was incredibly friendly. Also really interested in where you were from, what your history was, what you were interested in, and then on our benches was, a dedicated backbencher just committed to animal rights, to certain health conditions, in promoting better diagnosis and care of those. So, he was one of those who was just a really decent, hard-working backbencher.
We don't know everything at this point about what happened. We do know some things. The 25-year-old man who's now been arrested on suspicion of murder, the knife that was recovered. What we don't know about is the motive. We know sort of what was happening at that moment, that Sir David was meeting with constituents, as happens every week at those constituency offices. Is there anything more that you know?
No, I mean, it's obviously the investigation is now being led by counter-terrorism police. We don't yet know, it hasn't been confirmed whether there's a terror element to this. They've released some further details on the 25-year-old who's arrested. But, what Sir David was doing what lots of us do on weekends, which is we hold these things called surgeries. We call them constituency surgeries, where you rent out a local church hall, village hall, parish hall for a few hours and invite constituents to come and raise issues. It's one of the great traditions of the British political system, of being accessible to constituents in that way. And he was just doing what lots of MPs would have been doing today. And, as I say, all we know up to now is that counter-terrorism police are now investigating. And it was obviously a just very, very tragic set of circumstances.
Can we talk about just sort of the security situation here? This is not something where Sir David Amess would have had police alongside him as a regular member of Parliament. But this is now the second killing of a member of Parliament in the past 5 years, following the murder of the Labour MP Joe Cox in 2016. I know that the Home Secretary has now asked police forces to review security arrangements for MPs with immediate effect. But what does this broadly say, do you think, that you've had 2 murders in the span of 5 years of members of Parliament?
Well, I don't think there's a member of Parliament who hasn't had threats to their family, death threats. I've had to get restraining orders against people. My constituency neighbour just a couple of weeks ago received an anonymous letter from an anti-vaxxer informing her that they knew she had a child and they knew which school her child went to. Sadly, all of us have been on the receiving end of this, and I'm sure that's the same for our colleagues in the Canadian House of Commons as well. Security was beefed up following the death of Joe Cox back in 2015. We've all got personal panic buttons and police alarms in our houses, and our constituency staff are protected by the same things. And we have, as I say, controlled entry systems and all the rest of it. But at the end of the day, if somebody turns up at a constituency office asking for help and, they sound plausible, of course we're going to let them in. Of course we're going to make an appointment to speak with them. So there are limits to what you can do, beyond simply not meeting members of the public. And one of the great traditions of the British parliamentary system is that we get out there and we meet our constituents at weekends. And in some respects, you're a sitting target. So, there is going to be a review. The Speaker will presumably say more about that. But, unless there's personal security provided, which I don't think a lot of MPs would welcome, how you guard against, what are these very rare incidents, but sadly have become more, certainly the threats have become more prevalent in recent years, is a conundrum, really. And, people will always get access to their MP, and that should be the case.
You say the threats have become more prevalent in recent years. Why?
Well, there's been, apart from take the terrorism element out of it, we have a situation now, you saw it with the Capitol riots in the US, you saw it with the hard left in the UK, with anti-Semitism, with the infection in the Labour Party, of just extreme language in politics and, dehumanising your political opponents. We had the deputy leader of the Labour Party here only 2 weeks ago at their convention describing Conservatives as scum. And, in democratic systems, and there's no suggestion that's had anything to play today, but we've got this more extreme language, both on the far left and on the extreme right, and even indeed, sadly, among some mainstream politicians. I mean, you only have to look at what certain elected officials have said not too far from you in recent months and years. We just have a buildup of more extreme and more aggressive language, and a dehumanization of people on the other side of politics. And, that's always been the case at the extremes, but it's sadly made its way into the mainstream. I mean, as I say, when the, the deputy leader of our opposition party here calls people on my side of politics scum, well, that's not healthy for democracy, because people have to be able to respect their political opponents. This may well be terrorist related. That's in a slightly different box. But we've just seen this increasingly extreme language. You've seen it with anti-vaxxers as well. And that is, manifesting itself in threats to members of parliament on a whole range of, political issues, vaccines being one recently. It's a very dangerous state of affairs for those of us who, cherish democracy.
Yeah, I think about back to when Joe Cox was killed 5 years ago, killed by somebody who had been radicalized on the far right, by the far right, and had come to occupy the far right. When you look at what has transpired, particularly with that threat that many security agencies on both sides of the Atlantic have warned about, the threat, particularly from the far right, and I acknowledge it's not exclusively from there, but that there has been a considerable increase of the threat from the far right. Do you believe that it is being dealt with accordingly?
Well, I mean, it's coming from all quarters. It was, in my time in Parliament, we've had Islamic terrorist attacks on Parliament as well. We've had a number of, attacks on the tube system here and on members of the public from that element as well. So, it doesn't belong to any one side of the extremes, sadly. But, Joe Cox's was a far right attack. We're not clear yet what the motive was today, but there's increasing activity, to be perfectly honest, on the far left and the far right, and both of them are very dangerous. Whether that's people attacking politicians or attacking property or violence on the streets, and is a problem governments are going to have to get to grips with, because there are a group of people in all of our countries, and it's the same in Canada. It's no different to here in the UK, who, thanks to a lot of the online activities that take place, are vulnerable to being radicalized by the extremes. And I'm afraid that seems to be a problem that's getting worse at the moment, and nobody seems to have the answer to that. But and they are pinning themselves on certain issues, as we're seeing at the moment with the anti-vaccine movement here, and I know over there. I was only in Canada recently and saw some of that myself. It's an issue governments are going to have to get to grips with, but it's also very difficult because a lot of this is taking place in the darker recesses of the internet, and that's very, very hard for any of us to police.
That was our conversation earlier with British Conservative MP Andrew Percy in London. Now, we also want to note the news that has just developed tonight that the Metropolitan Police in the UK say the murder of that British lawmaker, David Amos, in Essex, has now been declared a terrorist incident. Counterterrorism officers continue to investigate both on the scene and have and through records. They have a 25-year-old man in custody, but further details at this point are not known. All right, so it's official. The Prime Minister announcing today when he and the other 337 other MPs will be heading back to the House of Commons. First, though, the new cabinet. It gets sworn in on October 26th. A couple of weeks later, more than a couple of weeks, on November 22nd, Parliament will begin a new session. According to the PMO, pandemic recovery, paid sick leave, and the conversion therapy bill that died in the last Parliament are top priorities for the federal government. So why wait until November 22nd to get back to work? Power Panel is here for one last round to talk about that. Niigaan, Marika, Paul, and Marty. Okay, Niigaan, I throw to you. There is the question of timing, and yes, the opposition parties are attacking the Liberals for this. Nearly 2 months after an election that returned relatively the same result, why does it take that long to get Parliament back running?
Well, I mean, there's a number of things at play, but probably the biggest thing at play is Parliament's got to figure out whether they're going to mandate vaccines for MPs. And the challenge will be is while government workers across all of Ottawa will be required to have vaccination, I think there is a challenge to face when it comes to trying to figure out many of MPs. And it's weird for Erin O'Toole to come out and critique Justin Trudeau when he probably has the biggest issue of all to deal with within his own party around vaccinations. And so, taking 2 months, I think it takes a few months overall to work out that issue. But then on top of that, I think Trudeau's trying to figure out his next steps politically, because the election, of course, didn't go as expected, as well as there's a number of other issues that are facing. The sexual misconduct issues in the military are just becoming so rampant and so evident. It's very clear that Minister Seguin must leave, must be removed in some way, and trying to get issues like gender parity in cabinet, as well as many other challenges that the government's facing. I just think they're walking on ice that they're uncertain of in unexpected ways.
Marika, let me go to you on the timing. I think there is a fair amount of surprise in this town. I think there was some assumption that things would get rolling fairly quickly, and they have not, and apparently will not.
Yes, and full disclosure, I was one of the reporters who reported that people were saying they were going to move quickly. So take what I'm going to say next with that giant grain of salt, I guess. But I do think that...
That's awesome.
Unnecessary.
I do think that there is that question, because why are they taking so long to essentially implement the mandate that they already had? There was not some massive new thing that they are trying to figure out right now. The one thing I do note is that with the travel calendar for the Prime Minister, with him being in Europe and for the G20 and for the climate change negotiations, there is this chunk of time in early November when he won't be here. And, maybe this comes down to also negotiations and figuring out what parts of the opposition parties' platforms they want to make a nod to in the throne speech. But certainly we are seeing them taking quite a bit of time to regroup from this. I mean, they haven't even had a formal caucus meeting yet for the Liberals.
All right, Paul, can we talk about some of the priorities that are there? The government has listed 3 of them. What are we to make of that?
Well, they do assert a sweeping mandate for bold action on climate, on finishing the daycare negotiations with those provinces that they haven't cut deals with, and on whatever the third one is. COVID.
Remember COVID?
Yeah.
Oh, yeah. Reconciliation.
Even there, it's a little hard to square their assertions of bold mandates for sweeping change with the fact that months are going to go by before Parliament sits again. But you put your finger on one practical consideration, which is that autumn is often a time for international summits, and the COP in Glasgow, the big climate summit in Glasgow is a big one. I remember in 2015, at about the same time in the year, the Trudeau government was freshly elected, and his entourage was vocally frustrated with how much travel the guy had to do when he was trying to get a government up and running. But the fact remains that there will have been 5 weeks between the election and the swearing in of a cabinet. That's the longest delay between election and cabinet ceremony in 21 years. It's about twice as long as governments since 2000 have usually taken to swear in a cabinet. Then there's a longer delay after that. Justin Trudeau doesn't like Parliament. One of his first acts in 2016 was to seek to implement parliamentary debating rules that would shorten debate for almost all measures. His first measure when Parliament came back after the initial shutdown in the summer of 2020 was to seek unlimited spending authority at the whim of the finance minister for 2 years into the future. Then he prorogued Parliament. Then he spent 5 weeks complaining about all the other parties, including the NDP, who he says when they point out things that his government promised and hasn't done, hurts reconciliation. He doesn't like the opposition parties. He's going to go as long as he can without having to face them.
Marty Paul's brought up the question of the cabinet. So 5 weeks. The only thing that we know for sure is Chrystia Freeland staying as Deputy Prime Minister and Finance Minister. We've heard all the speculation and the guesses and lots of talk about the defense minister and a belief that he can't stay. But what do you think about the considerations that must now be going on in the PMO heading into that cabinet shuffle?
Well, I think it plays a little bit like, I think the long lead time, I take Paul's point that Mr. Trudeau doesn't like Parliament. There's obviously ample evidence of that. I think it also suggests that there's going to be a lot of newbies in cabinet. I don't think that the lead time would have been nearly as long if you were coming back with faces that had been there before and don't have to get up to speed. The other thing I was thinking about too is, it was 2 days ago that Pascal Saint-Onge, the Liberal member from the townships here in Quebec, that the recount was finalized and that she won. That suggests too as well, like I think she's going to be an important part in this cabinet because very accomplished woman from Quebec in a time when they want gender parity within cabinet, that perhaps they were hanging on to see if she was going to win the election or not. But again, it's the issue of a long lead time. I think there's also a recognition on the part of the government that these kinds of questions don't necessarily hurt them politically, so they can probably get away with it.
Niigaan, let me circle back to you because you mentioned reconciliation there as a priority for the government. And, of course, that is a long road, but it is a long road for the Prime Minister that is now going to have to pass through the Tk'emlúps Teshwekmek First Nation in Kamloops on Monday. What does the Prime Minister need to be seen doing? What does he need to say, given everything that's transpired leading up to it?
I think you pointed it out. He needs to be seen. And the big issue is he wasn't there. He didn't wear an orange shirt on the National Day of Truth and Reconciliation while the rest of us did. And the real challenge is that this Prime Minister needs to be seen as listening more than talking. And that was how easy it would have been on the day of, but now has to do double time. Now what you have is you have survivors across the country who are telling reporters that they were on some kind of unknown list and were told that they were going to get a phone call on that day, or told they were at least lottery to get a phone call. So badly handled. Like, the comms on this is a nightmare. And it's almost like no one in the Liberal government is thinking in any way what the Prime Minister or his office looks like. And it reminds me a lot of the other ways, all of these other scandals going back to, the We Charity, going back to Jody Wilson-Raybould. I mean, you just list them all off. How badly the Prime Minister continues to look on the issue of reconciliation, something that he just wants to keep talking about and putting in this central position. But it seems as though there's just no communication plan here. And so what I would tell if I was advising the Prime Minister is listen, stand there, and meet as many people as possible in a safe environment. I think this is a very safe trip. This is not something we talked about previously in terms of worrying about safety. Mm-hmm. But it's going to involve a lot of hurt feelings. It's going to involve a lot of people who are want to say a lot of things. And if you're not ready to hear those things in an honest and legitimate and sincere way, and that's one thing this Prime Minister does have going for him, is he comes across very sincere. However, that sincerity has been chipped away so badly at this point. One wonders if him showing up means anything at all.
All right. We will leave the discussion there. Thank you very much to the four of you. Have a good evening and a good weekend. Certainly appreciate it.
Thanks, Mike.
You.
We got some breaking news coming out of the United States, and it is the news that many Canadian travelers have been waiting and hoping for. The U.S. Centers for Disease Control says it will accept mixed doses of COVID-19 vaccines from international travelers, meaning if you got an AstraZeneca for your first shot and some mRNA for your second, you're considered fully vaccinated by the Americans who plan to reopen their land and water borders to non-essential travel from Canadians starting on November 8th.
It's a mess. It's a teetotal mess. I mean, they give me something when I really needed it, and now they want it back.
Some people who make their living fishing in Canada are getting an alarming letter in the mail saying they owe money, a lot of it. CBC News has learned that more than 4,000 of them have been asked to give back $25 million in COVID relief. They got the money through the Fish Harvester Benefit and Grant Program, but the government says they were ineligible because that program was meant for self-employed harvesters. Chris d'Entremont is the Conservative MP for West Nova, where a lot of these affected people live. He is in Yarmouth, Nova Scotia. Okay, so Chris d'Entremont, you have heard what DFO, Department of Fisheries and Oceans, has said, that these people were ineligible to receive payment. What's your take on what's happened here?
Well, ultimately, it shows that the Department of Fisheries and its partners, CRA and Service Canada, don't understand how fishers get paid in the fishing industry. This is definitely a challenge of what we understood or what we underlined to them way back in August of 2020.
Okay, but they say that the program was meant for self-employed harvesters. When you say they don't understand the industry, what do you mean in the context of how these people are paid?
Well, I would say all fishermen are independent contractors. They move from season to season. They move from species to species, from boat to boat. When it comes down to the pay side of things, depending on who they're working for, will sort of fire that down in one way or another. They're paid for by a business. Sometimes that gets put down into hourly wages. That's where the challenge runs in, where the department itself doesn't understand how those fishermen are actually paid.
When the government started handing out COVID aid, there were warnings that people might be asked to pay back if it turns out they weren't eligible or if they got overpaid. So, you know, it certainly happened with CERB. People had to pay back money they weren't eligible for, and it was just the effort to get money out as quickly as possible. How is this different?
It is not very much different at all. What really happened here is that there was an announcement from the department way back in like May of that year. By the time the program actually got rolled out, it was August. We underlined a bunch of the problems with how the application was being rolled out. But here we are. I mean, we're a year and some later. A lot of the folks have received that money, have paid taxes on that money, have spent that money on different items. The industry was affected just as much as anyone else. Captains were able to get money. Businesses were able to get money. The only people that haven't been able to get money are the crew members themselves, which are the core of the fishing industry. Like the CRB or the CERB, where people were supposed to pay things back, ended up not paying things back. I think should be a little, we should look at that a little more openly on how fishers are paid and exactly, what kind of benefit did they receive and whether or not we need to go back and look at how CRA actually, Service Canada actually looks at how it's logged in when they pay their taxes at the end of the year.
Yeah, I just want to sort of get to the idea of fairness. So there are people who received not this benefit, but other COVID-related benefits. They were overpaid or they were ineligible, and they did have to pay that money back. There were some instances like that. So why should those people that you're now speaking about be any different?
Well, ultimately, the department went up and said this was for crew members. This was for people that received a share of the catch of the fish. There are some days where fishermen receive a good pay because they caught fish. There's other weeks that they don't get paid anything at all because they didn't catch anything at all. So, there has to be a better recognition of the challenge that they are as fishers. They did have a negative income or an impacted income during the early stages of the pandemic. This funding, they weren't able to receive any of the other programs, CERB or EI. So in this particular case, this was the only funding that they could actually access while the rest of us were all locked down in our houses as well.
Okay, so if I'm understanding you correctly, even though DFO, even though the federal government is saying they are ineligible and they should pay it back, you're saying they ought to have been eligible and should therefore keep it?
They should have been eligible. I believe that they're eligible. We told them that they should be eligible. These are the guys that do the majority of the work, the guys and the girls in the back of the boat that do the majority of the work for the fishing industry. They were not eligible for other programs. They were told they could be eligible for this one. The programming itself shows that they still should be eligible for it, and yet there has to be being paid back $25 million of this. It's not fair.
Okay, people who did get these letters did have the opportunity, at least until today, to sort of appeal them. Do you know people who have done that and what it involved?
I would say the majority of the people that received the letters have appealed it at this point. That's what we had been advising these folks as they called our offices. We've had hundreds, if not thousands, of people call our offices, contact us through email or Facebook or what have you. We've had lots of actually accountants and accounting firms calling us and saying, well, here's where the challenge is. So they appealed. We're waiting to see what that appeal process might be. I do worry, though, that there are so many appeals that I don't know if the department can actually process them.
And what do you think they should do right now? Because there is the expectation that at least the first installment on the overpayment be repaid.
Well, I think they should extend it once again. They should do a little more consultation, maybe talk to some of the fishing organizations that have been speaking out against this one as well. Maybe talk to a few accounting firms to understand how fishers are actually paid, and then make a decision later on. I mean, there's a little bit of time here, but I know we'll continue to bring this up when the House of Commons actually sits in November.
What are you hearing from people who are actually impacted by this in terms of their, I guess, worries about a potential debt they might have?
Well, ultimately, some fishing or species have done well. Other ones have not. I do talk to a lot of folks that just don't have the cash right now or are unable to actually pay that back. They don't want to see that effect on their taxes at the end of the year. So they're worried, and in some cases it's $6,000 or more dollars. That's a big chunk to actually pay back all of a sudden. So there has to be a little bit of compassion here. We're still in the pandemic. We're still finishing up that fourth wave. Nothing's back to complete normal. So I would say until things are really back to normal, I think the department should sort of slow down a little bit, show a little bit of compassion, and just hold on until we can figure this one out correctly.
Chris D'Entremoth, thanks very much.
Thank you.
And that's it for today. Make sure you follow our pod so you don't miss any of the latest political news. And if you like this episode, do share it with a friend. Thanks a lot for listening.
For more CBC podcasts, go to cbc.ca/podcasts.